Welcome to Ulosca channel. Access all nursing practice questions. HESI Pharmacology practice questions with answers.
Question 1. A nurse is administering 4-potassium chloride. What is the correct action? A. Administer 4 push over 1 minute. B. Mix KCl in 10 milliliters of sterile water. C. Infuse using an 4 pump. D. Shake the bag vigorously before use. Which one is the correct answer? The correct answer is C. Infuse using an 4 pump. Explanation. Potassium chloride is a high-alert medication. It must never be given 4 push because it can cause lethal cardiac arrhythmias. It should be diluted in a compatible fluid and infused slowly using an 4 pump to control the rate and avoid rapid systemic exposure. Question 2. Which 4 fluid is isotonic and commonly used for fluid resuscitation? A. 0.45% normal saline. B. 3% saline. C. Lactated ringers. D. D5W. Which one is the correct answer? The correct answer is C. Lactated ringers. Explanation. Lactated ringers is an isotonic solution containing electrolytes. It is often used in fluid resuscitation for patients with trauma, burns, or surgery due to its ability to restore volume while maintaining electrolyte balance. Question 3. A client is receiving vancomycin for. What complication should the nurse monitor for? A. Hypertension. B. Red man syndrome. C. Constipation. D. Tinnitus. Which one is the correct answer? The correct answer is B. Red man syndrome. Explanation. Vancomycin can cause red man syndrome if infused too rapidly. This is a histamine-mediated reaction characterized by flushing, rash, and hypotension. It can be prevented by administering the drug slowly over at least 60 minutes. Question 4. What is the best action when an foresight shows signs of infiltration? A. Elevate the arm and continue infusion. B. Apply heat and increase the rate. C. Stop the infusion and remove the catheter. D. Aspirate the medication and flush the line. Which one is the correct answer? The correct answer is C. Stop the infusion and remove the catheter. Explanation. Infiltration is the leakage of fluid into surrounding tissue, often causing swelling and coolness. The priority is to stop the infusion and remove the catheter to prevent tissue damage. Elevating the limb and applying warm compresses may follow. Question 5. A nurse is preparing to administer morphine. What is the priority assessment? A. Pain scale. B. Apical pulse. C. Respiratory rate. D. Bowel sounds. Which one is the correct answer? The correct answer is C. Respiratory rate. Explanation. Opioids like morphine depress the central nervous system, including respiration. Assessing the respiratory rate is critical before administration to prevent respiratory depression, which is a potentially life-threatening side effect. Question 6. A nurse is administering an antibiotic. The client reports shortness of breath and chest tightness. What should the nurse do first? A. Slow the rate of infusion. B. Administer diphenhydramine. C. Stop the infusion immediately. D. Notify the provider after completing the infusion. Which one is the correct answer? The correct answer is C. Stop the infusion immediately. Explanation. Shortness of breath and chest tightness are signs of a possible allergic reaction or anaphylaxis. The immediate response should be to stop the infusion to prevent worsening of symptoms. The provider is then notified, and emergency treatment may be initiated. Question 7. Which 4 fluid is hypertonic and used to treat hyponatremia? A. 0.9% normal saline. B. D5W. C. 3% normal saline. D. Lactated ringers. Which one is the correct answer? The correct answer is C. 3% normal saline. Explanation. 3% saline is a hypertonic solution used cautiously to treat severe hyponatremia. It increases serum sodium by drawing water out of cells into the bloodstream. It must be infused slowly and with close monitoring to avoid neurologic complications. Question 8. A nurse prepares to administer 4-metoprolol. What is the expected effect? A. Increased heart rate. B. Lowered blood pressure. C. Increased respiratory rate. D. Bronchodilation. Which one is the correct answer? The correct answer is B. Lowered blood pressure. Explanation. Metoprolol is a beta blocker that slows heart rate and decreases blood pressure. It's used in hypertension, heart failure, and certain arrhythmias. The nurse should monitor vital signs before and after administration. Question 9. A client is receiving continuous 4-heparin. Which lab value must be monitored? A. Point INR. B. Platelets. C. APTT. D. Hemoglobin. Which one is the correct answer? The correct answer is C. APTT. Explanation. APTT is used to monitor the anticoagulant effect of heparin. It ensures the dosage is therapeutic and helps prevent bleeding complications. PTINR is used for warfarin, not heparin. Question 10. A nurse is hanging a new 4-piggyback antibiotic. What is the correct height placement? A. At the same height as the primary bag. B. Below the level of the primary fluid. C. Higher than the primary 4 fluid. D. On a separate pump. Which one is the correct answer? The correct answer is C. Higher than the primary 4 fluid. Explanation. The 4-piggyback should be hung higher than the primary fluid bag to allow gravity or pump-driven pressure to prioritize infusion of the secondary medication before resuming the primary fluid.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.